Hi, I'm Dr. Brad Shook. I'm a board-certified chiropractic physician in Hickory, North Carolina at Hickory Spine, and today I want to talk to you about getting in an accident on a bicycle. So a lot of people ride bikes. It's a great thing to do for exercise. It's a great way to commute. It's a great way to be environmentally conscientious and try to do the right things, but it's good for your body, lots and lots of benefits. But unfortunately, being on a bicycle also introduces some new risk. And one of the things that often happens is that there are careless drivers or someone that may have just not seen you, and it's all too common that people riding bikes are actually victims of um, poor decisions. Let's just say that. So one of the things that's really important to understand is that obviously you are exposed when you're on a bike, and cars are much larger. You're going to sustain all of the energy of the collision. You're going to be more likely to have severe injuries, as compared to being in a car and being struck by a car. So there are a number of different types of injuries that can occur when you're thrown from a bike. One of the things I'll tell you is, obviously we've worked with people that have had accidents on bikes, motorcycles, you name it. And the thing is that a lot of these people have very severe injuries that need to be dealt with first before the things that we would consider helping you with. So if you have more severe injuries, obviously they take priority. But if you have pain like spinal pain, neck pain like a whiplash, low back pain, after you've the more pressing injuries have been addressed and supported, then I highly recommend that you get the proper type of analysis or of examination performed. Okay, so let me explain to you what I mean by that. We see people that are in automobile accidents all the time, and I've seen thousands of patients in the clinic, and we have never once seen that a spinal ligament assessment has been performed. Now, what is that, right? Well, when you have a sprain strain or you have a whiplash injury, that's actually where you tear muscles and ligaments. That's what a whiplash is. You've torn muscles and ligaments. It can involve bone, it can involve nerve, but most of the time it's muscles and ligaments. And a lot of doctors, a lot of people just blow it off as, oh, it's just soft tissue, as if it doesn't matter, and say, well, just take some anti-inflammatories and it'll be better in a few weeks. If not, we'll send you to the orthopedist, and you go down that road. Let me explain to you a few things here. The ligaments that are damaged, they keep the bones of the spine in place. And this is not something that you can put back in place. Once the ligaments that hold the spine together are torn and they lengthen, then there is instability or looseness in the joint. That's not good, because what happens is that looseness in the joint creates friction over time. Even if you get out of pain, it stays. The ligament will scar, but the lengthening of the ligament has occurred. It does not shorten and tighten back up. So even if you get out of pain, so let's say you're treated for injuries that you had that are more pressing, but you had whiplash, now your pain's better, or you're not having many problems, you should still have your spine checked, and you should have stress x-rays taken with a computerized radiographic measurement analysis. Okay, it's a digital analysis of the movement of the spine. It's how all the biomechanics research is done today on the spine. So that's really, really important. That's what we do in our office to work up these types of injuries, so we can determine severity and prognosis, which means long-term outcome. Right. So if you've been unfortunate enough to be in an accident where you're on a bike and you're struck by a car or whatnot, then this is something that you need to consider. You need to consider when it's the right time. If you would like to be worked up and see if you've had a significant injury to your spine and do stress x-rays, I'd be happy to look at your case and let you know if I think that I can help you at all. But we'll help you to get the right diagnosis, and will help you to rule out more severe ligament injuries, so that you'll know, is there a likelihood that you're going to have spinal problems in the future? Because we all know that person, right? We all know that person that's had the injury, they were in a car wreck, and their life was never quite the same, and their back's always hurt them since then. That's due to a lot of undiagnosed, more severe ligament injuries that were minimized. Okay, so that's really important to understand. And then if you have these problems, we can help you with therapeutic approaches to help you so we decrease pain and help you so you don't heal back the wrong way, so you don't have excessive scar tissue, so that we improve the stability of the spine as much as possible. And you've only got about a 3-month window to make a huge difference. Now, sometimes we work with people beyond that, but the first 3 months is where most of the scar tissue is being formed. That's when we want to be able to mold that scar tissue and help make it thin and strong. So anyway, I hope this helps you better understand some of the complications and things that you need to consider if you're in an accident where you were on a bicycle. If you need anything, if you'd like for me to take a look at your case and give you my opinion, just give us a call at 828-324-0800, or you can visit our website at hickoryspine.com and learn a little bit more about what we do here. But I hope this has been informative, and I hope you have a wonderful, wonderful day. Thanks.